Good morning, doctors. Welcome again. This is our topic about radiology and radiotherapy. Complete MCQs regarding this. Now, threshold radiation dose for hematological syndrome is 1 gray. For GI, it's 5, and for CNS is 20. This is the explanation. Now, best investigation for the detection of bone metastasis is go for bone scan is the best. Which of the following contrast agent can be used in a patient with renal dysfunction for the prevention of contrast nephropathy? It's low osmolar contrasts. Yeah. Non-ionic low osmolar contrast agent preferred in the patient with decreased renal function to prevent contrast nephropathy. Egg on side appearance is a characteristic of transposition of great vessels. Most ionizing radiation among the following is alpha, but the most penetrating is gamma. Which of the following substances are used to coat the wall of CT scan room for the radiation shielding is lead. Which one of the following tumors shows calcification on CT scan is meningioma and ependymoma, but the best one is most specific one is meningioma. Yeah. Which one of the following is the most preferred route to perform cerebral angiography is transfemoral route. Which of the following ultrasound marker is associated with a greater increased risk of trisomy in 21 in fetus is knuckle edema. Okay. Now, the most sensitive imaging modality for diagnosis of the ureteric stone in a patient with acute colic is NCCT is non-contrast CT scan of the abdomen. Gold standard for the diagnosis of osteoporosis is dual energy X-ray absorptiometry. At t equals to 0, there are 6 into 10 raised power 23 radioactive atoms of a substance which decay with a disintegration constant equal 0.01 second. What would be the initial decay rate? So this is, I will explain you, 6 into 10 power 23rd into, this is 10, 0.01. So answer equals to 10 power 21, because if we do this, remove this one, 0 0, so below, so it removes 2, so 6 into 10 raised power 21. So C is the answer. Okay, see here, rate of decay equals to disintegration constant into number of radioactive atoms. So the technique employed in a radiotherapy to contract the effect of tumor motion due to breathing is known as gating. Yeah. Respiratory gating is a technique in a radiotherapy in which the radiation is applied during that phase of respiratory cycle in which the tumor is the best range. This is to prevent unnecessary radiation exposure to normal structures. Now, which one of the following radioisotope is not used as permanent implant? Iodine 125, yes. Palladium 103, yes. Gold 198, yes. But cesium is 131, so this is not answer. Okay. Yeah. In radionuclide imaging, the most useful radiopharmaceutical for skeletal imaging is technetium Technetium-99m linked to methylene diphosphate phosphonate. Now, gamma camera in a nuclear medicine is used for measuring of radioactivity. The MR imaging in multiple sclerosis will show the lesion in white matter. Multiple sclerosis is a demyelinating disorder, hence the lesion will be seen in the white matter due to loss of myelin. The most important sign of significant renal artery stenosis in angiogram is the presence of collaterals. Presence of collaterals indicate that there is significant renal artery stenosis. The most accurate investigation for assessing ventricular function is 2D echo, it's echocardiography. The most, it's already discussed. Yeah. The procedure of choice for the evaluation of an aneurysm is arteriography, which is the objective sign of identifying pulmonary pleura in chest radiography, is diameter of a descending right pulmonary artery more than 16 mm. Which of the following causes rib notching in a chest radiography? It's coarctation of aorta. Let's discuss. Superior rib notching we see in polio, restrictive lung disease, neurofibromatosis, connective tissue disease, osteogenesis imperfecta, hyperparathyroidism. Inferior rib notching we see in thrombosis of aorta, coarctation of aorta, Blalock Taussig shunt, occlusion of subclavian artery, pulmonary AV fish malformation. Now, the ideal timing of radiotherapy for a Wilms tumor after surgery is within 10 days. If we are not do within 10 days, the chances of relapse is more. Yeah. Which one of the following imaging techniques gives maximum radiation exposure to the patient? Is CT scan. Okay. X-ray gives 0.02, CT head 2.3, CT chest is 8, CT abdomen pelvis is 10, bone technetium scan 99 is for 4. Phosphorus 32 emits beta particle. All of the following radioisotopes are used as the systemic radionuclide except iridium. Sorry. Which one of the following has maximum ionization potential? Is helium ion, and maximum penetration potential is by gamma. Pleiothoric lung fields are seen in all of the following conditions except in Epstein anomaly. This pleiothoric lung field condition seen in left to right shunts. Okay, atrial septal defect, left pressure is more moves toward the right. Total pulmonary venous connection, anomalous pulmonary venous connection also same. Ventricular septal defect also same. So Epstein anomaly not same. Yeah. A 40-year-old female patient present with a recurrent headaches. MRI showed an extra-axial dural based and enhancing lesion. The most likely diagnosis here is glioma, meningioma. Okay. Now, which of the following features on mammogram would suggest malignancy? This is areas of speculated microcalcifications. On MRI, the differential diagnosis of spinal cord is edema. Cord edema is myelomalacia. Most sensitive serological indicator for aneuploidy is knuckle translucency. Most chemo-resistant tumor among the following is osteosarcoma. Sorry, this is malignant fibrous histiocytoma resistant. Yeah. Bone skin of a patient with multiple myeloma shows cold spots. A male was brought unconscious to the hospital with external injuries. CT brain shows no midline shift, but basal systems were compressed with multiple small hemorrhages. What is the diagnosis here is diffuse axonal injuries. Spongy appearance with central sunburst calcification is seen in. So guys, serous cystoadenoma. Now, which of the following tumor is least radiosensitive, least osteosarcoma? The diagnosis procedure not done in case of pheochromocytoma is FNAC, fine needle aspiration cytology. Most common hormone deficiency seen after intracranial radiation therapy is growth hormone. So guys, have a good day. Goodbye. That's all for today. If you have any queries, any question, you can ask me, and wait for my video. Whole radiology, whole radiology in a few minutes I'm going to put. So guys, have a good day. Goodbye. That's all for today. And if you have any queries, any question, you can ask me. And if you still not subscribe my channel, please subscribe it. Thank you and goodbye, doctors.